we are moving forward. Professional burnout among medical workers in Ukraine. Dr. Inesa Guivaniuk, surgeon oncologist at the Department of Liver, Pancreatic and Peritoneal Cardiomatosis Surgery of the Kiev Regional Oncology Dispensary, Executive Director of GMKA Ukraine, co-founder of the Search Fem project. Uh-huh. I'm very pleased to be here with you today, and I would really like for feminitives to be in our Ukrainian my project, Search Fem project. It's a project for feminine leadership and small things that help us fight gender inequality in Ukraine. So this presentation will be dedicated to burnout, professional burnout, and we hear it from the full-fledged invasion more and more often, but we need to have certain objective data that we can use as a basis for our strategies and policies to fight it. We don't have much time, so the presentation will be very short. If you have questions, I will be happy to answer them afterward in the halls. So, about the burnout, there is no conflict of interest on my part. There is a world statistic in the world. You see what happens in USA and also Northern Europe, but still we don't have any information about Ukraine, about our nurses and medical workers and doctors, even administrators who provide healthcare services. So to resolve this issue and find some pilot data, we made research, a poll throughout the Ukraine territory to find out how widespread this is and what factors influence the burnout among medics in Ukraine. It was cross-sectional research poll. It was a mass-like burnout inventory questionnaire used in the entire world. It's a unified questionnaire. So this questionnaire, it assesses three major blocks: emotional exhaust, depersonalization, and the lowered feeling of your own competency. So we use SurveyMonkey, the platform. It's best for statistical processing. So we disseminated this around Ukraine through emails and other online communication channels. So 950 respondents, medical workers, nurses, doctors, interns, administrators that provide medical services took part. More than 80% were women because women have more tendency to give answers to questionnaire in the entire world, and you can see the map. So the result, this chart is a bit complicated, but not really. But it's also a bit sad. The red, as you see, more than 50%, it's doctors and medical workers that feel that they are mentally exhausted, that the burden is too high, and they don't even want to talk to the patients. So this is what is happening with medical workers on a daily basis. So they're feeling that they are overworked, they are stressed out, even just talking to the patients. So more than 50% people need to make an effort to be able to interact with other people and to perform basic tasks in their job because they are already burnt out to some extent. So they feel overworked and they feel stressed out every day in their work. So if you look at this statistically, there is no time to delve into it, but still, if you combine all the data and analyze them statistically, we can see which medical professions help us avoid the burnout and which are the higher risk of professional burnouts in doctors. So, dermatology uh, is the best profession to avoid the burnout. But if you work in psychiatry of medical medicine, which is very relevant in Ukraine, then the risks of burnout get higher. Also, on this picture, you can see conclusions. The more the person works, the more the risk of burnout is. More than 12 hours a day, they get the burnout faster. And people who work in large hospitals, more than 500 beds, and state-run hospitals, also the risk of burnout is higher. And uh, gender or regional split have no influence on the burnout risk. So consequence summary. So the research we did, the first in Ukraine, so burnout is quite present in Ukraine and we have all the data to support it. 36% report that they every day they feel emotional exhaustion at work. 10% they feel depersonalization on a daily basis. During the day, they can just feel that they are very distant from their own personality. It's like they don't belong here, they don't belong in this office, whatever. And 32% report everyday stress in their interaction with patients. So we encourage doctors to use proper communication, but on the other hand, 30%, more than 30% already stress just about communicating, not talking about the quality of communication. So this is the biggest research, the biggest poll um, taken in Ukraine. It's on the individual level also. Recommendations we propose. So intervention on an individual level, resilience programs and support networks for doctors and medical workers. And I, I recognize the presence of mental health representatives here in this audience. So and the healthcare system should make sure that people are not overworked. Also, interventions on the policy levels. It's not always a priority, but still, let's not forget that every day these people provide help to civilians and military men. We have to understand that this resource it should be kept inside of the company. So, digital and technological solutions. We mentioned AI today. AI might help us even at least prevent or detect the burnout at early stages. So not to make it more complicated. And also research and monitoring, gathering data all the time. It can help us have adequate data in order to make right decisions. Also, as a representative of GMKA, I would like to invite you to the forum Lviv, which will happen this Friday and Saturday, 26th and 27th of September. We will be happy to see you there. On the 26th, we will talk about the quality and safety of the healthcare in Ukraine with some people who are here in the audience today and other stakeholders in Ukraine and on, and then another forum about the gender equality and feminine leadership on the 27th. So see you. Hopefully, I'll see you there.